Hi, I'm Kati Vincent, nurse practitioner with the Advanced Cosmetic Surgery and Laser Center. We can also use neurotoxin to treat disorders like TMJ, so the disorder of the jaw, TMJ or TMJD. This masseter muscle right here, and you can see Liz actually has really strong ones. You can relax and then clench, relax and then clench. Yep. You can see that tensing there, and she's even using her temporalis muscle up here. Part of her temple is compensating with the closure of the jaw. So a lot of times people have what's called bruxism or jaw clenching, teeth grinding. All of those things can cause an overreactive masseter muscle. We can utilize neurotoxin to gently just relax a little bit of that overproduction of that muscle, that overworking of that muscle, soften it. It also, with the softening, when they're this large, it's called a muscle hypertrophy, or the muscle is much larger than it should be. The neurotoxin will actually, over time, through multiple treatments, will make that muscle a little bit smaller, and it can help slim the appearance of the face as well. If we're seeing that your jaw is really taking up a wide angle, that neurotoxin placed there over time can shrink that muscle and give you a slimming effect of the jaw. I'll show you how we mark for that masseter muscle area. I'm going to have you relax and then clench, relax and then clench. Yep. Here. I usually use 3 injection points into that masseter. We're wanting to make sure we stay below that. We want to not affect her parotid gland. There's a gland right here that's really important that we not affect that, but we just place it into the muscle itself. And you can really feel on her exactly where it is. So this is a great patient to show this on. When I'm placing the toxin, we want to go deep for the injection, but then also pull out and retrograde inject, because there's a tendon that lies between the 2 bellies of the masseter muscles. So you want to make sure you're capturing both of those muscles. This is why, again, it's really important to have an expert injector that when you're treating these areas of the face. You want to make sure they know all these things about how the muscles work and how to capture those appropriately. Again, I'll have you clench one more time and then relax here. Big stick, I know. And sometimes it feels a little bit in this muscle because she's so strong. It kind of feels like a little bit of a trigger point injection. Relax and clench again. Clench, perfect. And because this muscle is so strong, it typically does take quite a bit of units. So I'm doing 20 a side on her. How did that feel?
It wasn't that bad.
A little pinchy going in. Yeah. But often you do kind of get a little bit of a trigger response, especially when a muscle is so strong and so tight and overworked.
All right.
It feels a little bit like yours are wild. Yeah. It does feel a little bit like that trigger point injection. So initially you might feel a little out. It's almost like it hurts so good. Like you feel it and you know it's in the right spot because it goes right into that angry, overworked muscle. Just like any other part of the face, there's usually some asymmetry. So clench again and then relax. Her right side is a little bit stronger than her left. But the best way to make sure that you assess for the differences is relax and then clench again. Yep, right side is definitely a lot stronger and it tracks up a little bit higher too. Clench again, and then relax. I don't know if you can see this, but there's a nice big vein right here, right in front of the area that I'm injecting in. I want to make sure I'm not getting close to that vessel there. All right, big pinch here, pinch, pinch, pinch.
Mm-hmm.
Clench one more time. Okay, relax. Clench again. Relax. With this, you see me going all the way into the hub of the needle, but then I'm still retrograde injecting on my way out so that we capture that both bellies of that masseter muscle. And that's it for masseter tox.